Recent research has shown that there is a connection between our sleep patterns and developing dementia. Now, if this concerns you, like it does me, I feel very fortunate that we have Dr. Sehgal here from the neurology department to discuss the findings and hopefully give us some hints on how we can all get a better night's sleep. Thank you so much for your time. So tell me a little bit about the findings and what this means for our sleep patterns.
So there's a recent study that was presented at the Alzheimer's Association conference, which looked at adults who were not getting enough sleep and compared to adults who were getting enough sleep. So lack of sleep was increasing the amyloid beta deposition in the brain. Now this beta amyloid is the protein that is the hallmark finding in patients who have Alzheimer's disease based on autopsy studies. So if you are accumulating more beta amyloid due to lack of sleep at night, that would mean that you are at a higher risk of developing Alzheimer's disease.
So what do those findings then mean for TMH and the work being done here?
So we've always ensured that our patients in the memory disorders clinic are asked about their sleep patterns and whether or not they're getting enough sleep. We are actually collaborating with the sleep center in trying to formulate a research study which would look at providing those patients enough sleep, whether it is with medications or other aids, so that we can improve their memory in the future.
Now, I think most people understand the strong connection between getting a good night's sleep and kind of regenerating your body, but how does sleep affect your brain?
So this goes back a few years when we had some data from mice studies which showed that mice, while they are sleeping, flush out this beta amyloid from their brains. So that would mean that during the time that we are sleeping, our brains are able to flush out this beta amyloid and in effect reduce the amount of beta amyloid deposition in the brains. So if we're not getting enough sleep, we would have more of these bad beta amyloid proteins in the brain, which would increase the risk of memory and concentration problems during the day, as well as more serious problems such as Alzheimer's disease later on.
So if these findings are sending off some red flags for our viewers, what's the best first step for them?
So the first step is to ensure that you're getting adequate sleep, and if there is something that is interfering with your sleep, trying to get away from those factors. But if you're still not able to get enough sleep during the night, you need to contact your doctor.
If we get enough sleep, experts say we will think better, we'll have better memory, better mood, and probably have a healthier heart. If you could sleep perhaps from 11 p.m. to 7 a.m. every night, that would be good. Another issue would be to turn off the bright lights, TV, computer, and any other electronic devices a couple hours before you go to bed. If we do that just before we go to bed, we can't fall asleep right away. And last of all, try to avoid excessive caffeine. Try to cut out caffeine after 12 noon. Even better, avoid caffeine totally.